I am a neurosurgeon. We deal with problems of the pituitary gland. There can be tumor formation in the pituitary gland where we come in picture. And these pituitary glands tumors can be small tumors, they can be big tumors, they can be huge tumors, and they can be massive tumors. And this is when we come in picture, when operation is required. Otherwise, the problems are dealt with by endocrine doctors or doctors who deal with hormones. Now, these pituitary tumors are of two types. One is when they are hormonally active, like acromegaly, growth hormone tumor, where the face becomes large, the hand, fingers, the legs become big. They're not only external cosmesis, but also the heart dysfunction, the lung dysfunction, the abdominal dysfunction. It just demolishes the entire body. There can be other kind of hormonal disturbances like prolactin secreting hormone disturbance, like steroid function dysfunction, thyroid function. There can be n number of hormonally active tumors. When they become extra active or more active than normal, then there can be a problem. So these tumors which are hormonally active is one group of tumors. And these tumors are usually small in size or micro tumors like Cushing disease where steroid function is affected. These tumors are microadenoma or small tumors and they are detected when they are very small in size. Acromegaly, growth hormone dysfunction tumors, when they become a little bit large in size tumors, but the whole body dysfunction, the tumor can be seen on the face of the person. Menstrual dysfunction, breast milk secreting problem. These are the dysfunction when prolactin comes in picture. And there can be various hormonally active tumors. Now some tumors which are not hormonally active, they become large in size, they keep on growing in size and they become large and very large and they present with visual problems. They can present when the vision gets affected and when there is a problem of seeing in the lateral aspect of the field, in the midline, and there can be blindness. Do good operation, you give new life. You change the hormonal function. You change the life of the person. If there is a Cushing disease, you treat, you cure the person. If you don't treat, the person can die. So there is a possibility of giving new life to the person. Acromegaly or growth hormone dysfunction, you do a good tumor, you change the face of the person. In the evening of operation, the hands become smaller in size, the legs become smaller in size. Not only hands and legs, which are cosmetic, the face becomes. There are hundreds of changes which come immediate after operation. You do a good operation, you change the life of the person. Like amenorrhea, or when the menstrual dysfunction is there. For growth hormone tumors, operation is the only treatment. For thyroid dysfunction tumors, the operation is the only treatment. When there is steroid dysfunction, there is a Cushing disease, the surgery is the only treatment. And when the patient comes with visual dysfunction, the tumor is large in size, surgery is the only treatment. So surgery has a huge role in the treatment of pituitary tumors, and if that happens, these tumors are not aggressive tumors, these are not high-grade cancers. All these tumors are low-grade tumors. You treat them properly, you cure them, you give them new life. Earlier we used to do by opening the head and all those things. Now we have got beautiful philosophy. We know how these tumors are, what are the anatomical confines of these tumors. Almost 100% of patients can be operated through nose. Very, very small percentage of cases need surgery from the head. Earlier, 20 years or 15 years ago, every patient was treated from the head. Our philosophy of how the anatomy of these tumors can be confined, how they can be localized, has completely radically changed or revolutionized the treatment of pituitary tumor. Our concepts are completely revolutionary in the field of endocrine tumor surgery. But when a situation arises, there are several treatment. Drug option is of course number one. Surgical option is last but the best if necessary. My best wishes to all of you.